Hi, everyone. Welcome. Hi, everyone. Welcome. Hospice Nurse Julie here. Every Wednesday, live at 5. I'm on here for an hour to answer your questions. Let me know how you can hear me, if it sounds okay, because the camera's a little further away than normal. So let me know how it goes. Come on in. Hi, Tara. Hi, Thompsy. Hi, James. Roxy. Carmine, I think. James, Dallas. Hi, everyone. Welcome. Come on in. Come on in. Hospice Nurse Julie here. Instead of scrubs, I have a hospice and palliative care sweatshirt. How does my sound sound? Welcome, everyone. So it's 5 p.m. Pacific Standard Time. Where is everyone else coming from? Are we worldwide tonight? Tomsy says, I'm in nursing school and I'm going to be a hospice RN. That's amazing. Tomsy, congratulations. Remember, Tomsy, nursing school, C's get degrees. Okay, so relax. All the nursing professors want to act like it's the end of the world and you have to get straight A's. You don't. Take it from me. However, I will say I did get straight A's, but I basically had an ulcer the whole time. And now that I'm out of nursing school and been a nurse for 16 years, I realized it didn't really matter. Carmine asked, did giving IV fluids to someone, I'm not sure, one of her loved ones, did it hurt her? In general, I always say don't give IV fluids to someone who is actively dying. However, you were there with your person, so if they seemed and appeared to be dying peacefully, then they were. So keep that in mind. Keep that in mind. Hey, Melissa, I have a question regarding my dad. The hospice said he has 2 weeks, and we did read through the little blue book. Okay, let me know your question. When you do have a question, just so you know, when I'm reading the questions, I'll be looking down at the computer and then I'll try to answer looking up at the camera. Try to write your question in caps just so I can see them. And please know that anyone saying thank you or hello or just joining the group, I am seeing your messages. Thank you so much for being here. It's rainy here in Santa Monica and doesn't rain much here. Laura says, how long before you can get put on hospice with a terminal illness? People wait far too long. People should go on to hospice the second they decide they don't want to do treatment anymore, or a doctor says there are no more treatments to do. Then they should go on hospice. So don't wait till they're bedbound and totally debilitated. Go on hospice as soon as there's no more treatment options. Thank you, Holly. My story says, I'm hoping you can help me with my hospice abuse. The police were caked on them, were afraid to make report, but the hospital called them. No, my stories. I'm so sorry. I would not be able to help you with that. I would, because I really couldn't get involved, but that's awful. That's awful. You can always try to report them to Medicare as well. Thank you so much. Because all hospices are funded by Medicare, so it's a federally funded program, so you can also report them that way. Melissa, I'm so sorry. I didn't see your question. I just see, does that mean it's accurate or will it be sooner? Oh, Melissa, I would go by what the people who are seeing your loved one, they're the ones seeing them. So they would be able to know. There's a lot of factors that go into saying how long someone has. So in order for me to know that, I would have to physically see them and know what's going on. So I would go by what the hospice says. If the hospice says that, they're likely somewhat correct. I mean, every once in a while, people surprise us. I have a question regarding my father. We recently brought him home on hospice. We are dealing with a significant contraction of his leg all the way up to his chest and cannot get it to extend. Advice. If it's not bothering him, personally, I would let it be. If it's not bothering him, you have to keep him clean and safe and comfortable. So it can be difficult to like clean where he's contracted. So always talk to the hospice company about it. They might be able to prescribe some medication for like relaxing and stuff. But a lot of times, you know, if he is clean, if he's safe, if he's comfortable, that's what I would say. I wouldn't worry too much about it if it's not causing him pain. If it is, I would work with the hospice company to try to help with the symptoms. But contractions are contractions. They're hard. They're tough to deal with. A lot of times because it's like this, contractions, if anyone's wondering, it's like the leg is basically like stuck and stiff like this. You can get like breakdown here or breakdown like in here because it's so constricted. So sometimes we like to make sure, you know, they're really clean in through here and through here, and then put a lot of powder and stuff there to kind of keep it nice and dry. But also, if it's not bothering him too much, I would again say try not to worry too much. Of course, easier said than done, right? Thank you for the $5, Eric. That's so nice of you. He writes, from your experience, my mother has CHF and diabetes. Her heart is too weak. She can't even do stairs and is 63. What can I expect? Eric, truthfully, it's too hard for me to know. When people aren't in healthcare, I totally understand how it's like they don't understand how much information we may need to make an accurate like statement, right? So for me to try to tell you what to expect with that would be unethical, really, of me from the internet just to be like, well, this is what I think. I would need to know much more, and it'd be better for you to talk to doctors that actually work with your mom. Generally speaking, what can you expect? I mean, you can expect what you're seeing already. So CHF is an up and down disease. So they'll like plateau out and be doing somewhat okay. And then they'll have an exacerbation of their disease, which means like a flare up where it could get much worse and they have to go to the hospital or something because they really can't catch their breath or their legs get really swollen, something like that. Then the hospital will get them a little better, but then they'll come out of the hospital and they'll be weak because they were in the hospital, right? So then they have a new plateau where it's harder and harder for them to do things, like you said, go up the stairs or walk to the bathroom. And then they'll slowly get a little better and then they'll plateau out again. So it's going to be a lot of that. And that can go on for 10 to 20 years. So not easy, but, and anything can happen, right? There's a lot of things that can go in there, things that can complicate stuff. But in general, that's what I see. It's like this stairway decline versus this like super sharp decline, if that makes sense. And yeah, so that's the best thing I can say, but that's me speaking very, very generally in general terms. Thank you, Funky Fern. I look forward to my lives every week too. Okay, so hey everybody, we just got on. It's only been about 9 minutes. I'm here for an hour every Wednesday, live at 5. So if you don't know who I am already, my name is Hospice Nurse Julie. I try to educate about death and dying and hospice and palliative care, and I try to answer your questions. OR Scrub says, I keep getting notices from you saying you want to talk to me. Are you legit? OR Scrub, I am legit. However, I am never sending anyone messages saying I want to talk to them. So that might not be me. No. Who is your first guest going to be on live? Abigail. Yeah, so Abigail is talking about, oh my gosh, Julie, teacher Julie, I think that's you. Thank you so much for joining my compassionate companions. I'm going to start going live, I think maybe once or twice a month with a guest, and I'll have them like call in through the live. So it'll be me sitting here and the guest in their home sitting there, and I'm going to be asking them questions. So it's going to be people like someone who is an expert in estate planning. So I always tell you to plan, and get a trust and do this and fill out advance directives. But then people are like, yeah, but how? Where do I start? What do I do? I'm going to have someone on that will help explain that. I want to have a medical, hospice medical social worker on. I want to have a CNA on, a certified nursing assistant who works in hospice. I want to have a mortuary person, mortician on, funeral director. Who else do you think I should have on? Janice says, first time catching you live. Jan from Folsom. That's amazing. Welcome, Janice. Just so everyone knows, if this is your first time here, we are a very nice community. Many people in the chat come here often, and we all kind of talk in the chat as well. So please feel free to acknowledge each other and talk to each other as long as we are all respectful, of course. Julie, you have inspired me to become a hospice nurse. I'm 30 and had no idea what to do when my kids were both in school, but now I know. Oh my gosh, Lauren, that seriously makes me so happy. So happy. Congratulations. Hi, I'm in second year with chronic liver disease, lost all muscle and strength. I'm 50-year-old male. Mark, I can say, you can live a very long time with liver disease, depending on how, like, quote unquote, bad it is. I do have a lot of videos on end-stage liver disease. It does not sound like you are there yet. So, but I am glad you're here. I am glad you're here. If a pacemaker is turned off, how long before the person passes away? Anne-Marie, so a pacemaker is just something that's already working on the electrical beat of like the heart. That's the pacemaker. So someone's pacemaker doesn't have to be turned off when they go on to hospice. It's only if they have a defibrillator, that thing that shocks the heart. So someone can live a very long time without the pacemaker or the defibrillator because their heart might not go into any irregular rhythm that needs to be shocked out of it. Now I'm not sure why they were being paced, probably because they were bradycardic, which means very low heartbeat. But if they're going on hospice already and then the pacemaker was turned off, that they likely will be dying from their terminal illness, not because their pacemaker is turned off, if that makes sense. Someone just doesn't turn off their pacemaker and then they die. Now, I don't know your particular circumstance, so maybe there is something with the heart of your loved one that I don't understand. So I can't answer that like with a for sure answer. So take what I'm saying as a general statement, because I don't have all of the information of your loved one, but I hope that helps. Hey, Tom C., it's your first live. I'm glad you're here. Oh my God, so good. Topo Chico. Sparkling water for kings. I have an interstitial lung disease. Ray says, I have an interstitial lung disease on oxygen, immunosuppressants, prednisone, and lots of other meds. Ray, that sounds about right. I'm glad you're on all of those things to kind of keep your symptoms at bay, hopefully. As a guest, how about an attorney that specializes in trust and wills? Diane. Yes, that's kind of like who the first guest I want to have on. What happened to your, oh my God, what happened to my new book advertising stand, David? I forgot it today. I knew I was forgetting something. You guys, I'm getting lazy. I don't have my stand, but I have my book. Nothing to fear. Demystifying death to live more fully. My stand. I just totally forgot it. Oh my God. That's so funny, David. Thank you for remembering that. You're so sweet. Oh, Mark says, what I meant to ask was, how can I regain my strength, have trouble eating, keeping active? Mark, I'm so sorry that I can't help you more. So I am like a hospice and palliative care nurse. So my specialty is basically allowing people to have their body be the guide. I'm not a physical therapist. I'm not someone who's like here to be like, I don't, I'm sure there are ways to regain your strength. I'm not trying to take away your hope in that. For sure there are ways. Am I the person to ask? No, because I am not an expert in that. I could talk a bunch of game and like give you idea and my ideas, but that doesn't actually mean I know what I'm talking about. Because I don't. So I would talk to your doctor about that. Talk to your doctor about that. Anyone in here, if I didn't ask or answer your question, please talk to a medical professional in your area. I know how annoying that sounds because I too want to get my questions answered easily from someone on the internet, but it's not always the best choice, which I'm not actually calling you out for that. I think your name was Mark. I could be wrong. I'm not actually saying like that's what you're doing, but just in general, I want everyone to know, sometimes it actually is better to ask someone who's more qualified than me. I love your shirt. I want it, Abigail. These are for sale. You can get it. I'll have to try to find where. It's like the Hospice and Palliative Care Nursing Association. You can get them. Clarence, you plan to purchase my book? Thank you. Yes, Anne Marie says the defibrillator has already been turned off. Yeah, so that tells me that your loved one will likely be dying from the terminal illness that they are on hospice for, not because the defibrillator is turned off. That's my guess, but I might not know something. There might be a detail I'm missing, you know. Thank you for everyone who's telling me to put my book up like this. It looks great like that, you guys. You're right. Thank you for everyone who's been saying they've purchased my book. I really, really appreciate it. Seriously. Thanks, John. Thank you, Eric. Oh, Eric. Okay. Eric says, my mom has had 4 heart attacks, had a defibrillator at the time. The hospital told me to be ready. I'm the one that tried to talk to her about funeral services. Oh, Eric, I'm sorry. Yeah. You know, if your mom is unwilling to prepare herself, right? Maybe you start preparing your own brain, what you're going to do when you get that call that she has died. Like, how can you prepare yourself so you can stay in the moment and be with her? I'm so sorry. I don't know if she's like not willing to like kind of help herself or what the deal is, but if she is willing to talk to you, that's great. Yes, I would talk to her about mortuary, funeral stuff, where she wants her house to go or any kind of money to go, any password she has that she wants you to have. All of those things would be great to have them have that all situated. Also, if I don't know if she's ready for hospice or if they think she should be on hospice, then maybe she should be. But a lot of times people with heart stuff, even if it is really severe, they'll still wax and wane and live for quite some time, just kind of going up and down. Yes, the book is available on Amazon. It's really available anywhere you get your books, but you could get it on Amazon, yes. Have you ever had a patient who would yell out at times, not in pain, just yell? Yes, Clarence. People yell out a lot. And it's not in pain, they're just yelling. Yes. There's also rhythmic moaning, like that. People do that a lot. I think it's a self-soothing mechanism. Oh my gosh. Anne Marie says, I've purchased the book and become a member, forwarding your channel to my family. Oh, thank you so much. Nothing makes me happier. Welcome, everyone. I'm Hospice Nurse Julie. In case you're new, you can tap the screen, that little heart below, to like kind of boost the live. But I am here every Wednesday live at 5. Write your questions in all caps if you're like really wanting a question answered and I haven't been able to get to it. And hopefully I can get your question answered. My stories, the name of my book is called Nothing to Fear. And my name is Julie McFadden. So you can always just type in or have someone type in for you, Nothing to Fear, Julie McFadden. And my book is on audio as well. And the book is available in the UK, yes. I would personally use your Amazon. I think that'll be best and cheapest for you if you're out of the US. Oh, Dawn. Dawn, can you just rewrite your question in all caps? It's really hard for me to go back because the chat's just so much. Thank you, CT. Kiki says, I'm on hospice, age 51. I have AML. What happens at the end? So if ever a disease doesn't stick out in my mind about like what happens at the end, that tells me that what happens at the end is usually pretty gradual and pretty typical and not like tons of symptoms. So that's one thing to tell you, because when you say I have AML and what happens at the end, nothing really sticks in my head of what happens with AML. I do see AML patients. I'm sorry, you guys. I can't stop drinking Topo Chico, but it makes me burp and I refuse. I'm still just going to burp on my lives because that's how good it is. So what I would say to you, Kiki, is one, thank you for being here. Thank you for asking that question. And I would say whatever symptoms you've already been having. So I don't know if you've been having pain or shortness of breath or like what's been going on, if anything. Those will probably continue, not necessarily increase, but maybe continue and will need to be managed. Or if you haven't been really having symptoms, you might not be really having symptoms. The main things you're going to notice are weakness, functional decline. So it's going to be harder and harder for you to do like everyday normal things. Get up and go to the bathroom, get dressed, take a shower. Like those things are going to be hard and you're going to need help to do them if you don't already. You're not going to want to eat and drink that much. Please listen to your body and do what it says. Don't force yourself to eat and drink. The more natural this is, the better you usually feel. So just ask yourself, like, am I clean? Am I safe? Am I comfortable? If you can say yes to all those things, you can relax, and so can your family or whoever's helping you. If you're not comfortable and you're having symptoms, you want to talk to your hospice team to help you. But in general, that's what you're going to see. Lots of sleeping, not a lot of eating and drinking. Lots of sleeping, not a lot of eating and drinking. And then you're going to start having functional decline, which means just hard to do everyday stuff. And it's just going to be like that until you die. And I say die, even though I think it makes everyone go, ooh, including me a little bit sometimes. And I talk about this day in, day out. I say that because I think we need to get used to saying it. Death, die, dead. Those are not dirty words. We don't have to, we can say those words out loud. I hope that helps a little bit. And if you are on hospice already, I would ask your hospice team what they think, what they can expect. Hi, Sandra. Oh my God, I love you. She said, hi, Julie. It sounds like laundry without the R. Laundry. Why can't I do this? Every live, she helps me with her name. And every live, I never know how to say it. And please know it's not you. If Rich, my boyfriend, was here, he would be dying laughing because he knows I cannot. I think I have a learning disability. I mean, we know I have dyslexia, which causes some kind of learning, but I cannot believe that you even put up with me, Miss Curtis, is what I'm going to call you. Oh my God! Does your book actually? When does my book actually comes out in June? Thank you for pre-ordering it. And thank you for putting up for me for never being able to say your freaking name. It's not even hard, folks. It's Saundi. Sandi. Right? Now, is that right? You guys, I'm ridiculous. Oh, wow. See, I keep thinking, oh, look at all these people gifted a membership. Someone's gifting a bunch of memberships. You guys, Bay Area Ghost. Why do I have such the most amazing subscribers and followers? Bay Area Ghost. I'm just seeing this. Wow. Thank you so much. What? You know what? This is probably a little too much information, but I'm going to say it. It's getting towards my time of the month, and I can tell because this makes me want to cry. I'm kind of an easy crier. This makes me want to cry that you just did that. Thank you so much. Thank you so much. That's amazing. What a wonderful community we have here. Thank you. Laura says, hope you're still here. Ellie, I see your $5. Thank you so much. And I'm going to answer your question in a second. Laura, small cell with liver mets. Would you know the life expectancy? I wouldn't, Laura. I wouldn't. People can live, it would truly be unethical of me to sit here during my lives and try to act like I can really answer like every question. And I just wouldn't know. I'd have to know so much more about the person who has small cell cancer, mets of the liver. I'd have to know so much more information. I would have to physically see them. I would have to know what treatments they've been on, what ones they haven't been on, if they just started, if they haven't just started. So many things I'd have to know for me to know life expectancy. I'm not sure how close you are to this person, but what I would do is, if you're really close, I would go to the doctor's office with them and ask the doctor that's working with them. Okay, Ellie says, thank you for the money, by the way. Do you battle with dietitians and doctors sometimes about hydration and nutrition plan for your patients? So no, not usually, because they are already on hospice. So once they're on hospice, and this is why it's not really known, like so many people on the other, like doctors in the hospital are kind of like, okay, never mind, they're on hospice. Dietitians, okay, never mind, they're on hospice. It's who I usually battle with is the family. I do sometimes have to have a hard talking to alternative medicine doctors who I feel like are taking advantage of dying people and trying to. I had a woman once who didn't know she was dying, which was horrific because she died like 2 days later and she was young. And it was very, very sad. I cried that day because no one told her she was dying. I was the first one to say that. And her whole family were like, what? You know what I mean? They were mad at me. What did you say? And I'm like, I was kind of like looking around, like just realizing that they're just now hearing this from me for the first time. I thought they had known this. Anyway, I was fighting with their alternative medicine doctor who was trying to get her to drink like 3 liters of grape juice a day. Don't get me started. Because, I mean, it was horrific. And she died 2 days later or something. It was awful. But so to answer your question, man, I'm getting off tangent here, or I'm going on a tangent here. To answer your question, I usually don't have to because I'm not usually in the hospital. But I would go toe to toe if people were trying to hurt patients. Can you have cataract surgery on hospice? Bay Area Ghost. Technically, I think you could, because that's not a procedure that you're on. Like if you're usually on hospice for like CHF or COPD or some kind of cancer. So you could go out and get cataract surgery technically, I think. But if you technically have less than 6 months to live, I don't know if they really would do cataract surgery. So, how many times can a person with dementia go through all the signs of actively dying and bounce back? Grandma has done this multiple times, recently talking to angels, followed by 1 week, no food and water. Lonnie, wow. I would say 1 or 2 times. 1 or 2 times. If they're truly in the, like the whole like 1 week with no food and water, I bet that maybe maybe one more time after that, only because people with dementia do not follow like the regular pathway that people on hospice do. They kind of, again, what they do is like they'll be going along, not really themselves. They're like new dementia self, right? And then something happens, which usually is a fall, aspiration pneumonia, which means they choked on something and then got pneumonia, or like a urinary tract infection that turned into sepsis, which is an infection in their blood. So it's something serious. And then they're here, and then something happens again, and they go down. And then when they're down here, it looks like they seriously might die. So they could go through all the things, unconscious, not eating, not drinking, and they think this might be it for a few days. And then suddenly, boop, 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 they start going back up and they'll plateau out again. And that can happen kind of several times, depending on the person. Thank you so much, HR. Hey, Tyler. Oh my God, this is so good for some reason. Yeah, Abigail said, my dementia patient had gone through the actively dying stage, unresponsive, given end of life meds 5 times before he died. Yeah. As my dad's caregiver, who has many cancers, his stomach has started emptying out his nose, stopped feeding yesterday. Could you give me a rough idea of what to expect if he does not? Okay, so Jackie, I'm glad you're here. So is your dad on hospice, Jackie? That's what I want to know. I'll still answer the questions, but tell me in the comments if your dad's on hospice or not. If he's on hospice or palliative care, please talk to them too. Do not just use this because I can only speak to you generally, because I don't know of the rest of the stuff. Like I don't know all the other details, right? And I'm not even seeing your dad. So this is just generally speaking. If your dad is truly end of life, which I'm not sure how old he is, but it says he has multiple cancers. He sounds like he's having tube feedings. If he no longer eats and drinks, which is okay, because if you have to stop the tube feeds because they're coming out of his nose, that's telling you no, he's not on hospice. Okay. I wonder why. See, this is the stuff I don't know. I don't know why he's not on hospice. Is he receiving treatment for his cancers? How old is he? So sorry. How old is he? Is he receiving treatments for his cancer? Is he alert and oriented? So generally speaking, Jackie, if he's not on hospice, it's really hard for me to answer that question because I'm only talking about end of life here. If he's not technically end of life, then I don't know. Welcome, everyone. I'm just waiting to 58. Oh, he's young. 58. Oh, Jackie, I'm so sorry, Jackie. 58's young. Okay. Jackie, this is what I want to say. Because he's not on hospice, it's really hard for me to answer that question, right? So he sounds like, I don't know who. He can't have any more chemo or radiation. He's at end of life. Okay, then he should go on hospice. If we can get the hospice thing going, that should happen just to help you, okay? And him. So that's one. Thank you for being his caregiver. That's really hard. When someone is at end of life, let's just say he is, okay? Because you just said he's at end of life. So let's just say he is. When someone's at the end of life, this is what you have to remember. The body already knows. The body has already done a bunch of things to try to not be end of life, but now it is. And the body starts kicking in. Hey, I know what's going on here, and I'm trying. There's no hospice here. Where are you? What? There's no hospice there. Where are you? You don't have to tell me where you are if you don't feel comfortable. There's no area hospice here. So, okay, if not that, then maybe palliative care? Huh. Because he's going to need medications and stuff. This is more than I can't give you medical advice. So just generally speaking here, just so you know, our bodies are built to die. So there's a reason why he's no longer tolerating the tube feed is because his body is shutting down. Hence why you see it coming out of his nose. So you have to stop the tube feeding. Then because the body's saying no more. Even if you didn't stop it, it wouldn't tolerate the tube feed anyway. And then the body is going to naturally start shutting down. So your dad will not feel hungry and thirsty. And if he does, you can always like give him like ice chips or popsicles or things in his like sponges in his mouth. And generally speaking, we allow the body to be the guide. So we don't force feed, we don't force food and water, we don't force anything. And as long as your dad is clean and safe and comfortable, we allow the natural process to take over. Now he is young, so that may take 2-3 weeks. But in general, you should not be going at this alone. So don't just listen to a nurse on the internet, okay? As much as I think I know it all. Don't just listen to me. You have to get help from people in the community, a doctor. You need to get set up with something. And also, if he's alert and oriented, you got to talk to him about what he wants. You know what I mean? Does he want to die naturally at home? Is that what he wants? And if he does want that, then you have to help him get set up for that. That's a lot of responsibility on you. And if he's 58, you are young. So please get help. Please get help if you can. He has to have some doctor that can help you, please. Does all of that make sense, honey? Have you ever had a pet on hospice? No, but there is a hospice doctor on TikTok that talks all about this. Jackie, I'm so glad you're here. I know I just like hit you with a lot, girl. I know I just hit you with a lot. So if there's any, let's see, what day is today? Today's Wednesday. Yeah. If your dad has any doctors that he is at least talking to still, or you are, or someone in your family is, you have to ask them to try to help you get set up. Are you in like rural upstate New York? Because there should be like several hospices around. I'm surprised. You have a visiting nurse. Okay. He can no longer speak. Okay, so you have a visiting nurse. That tells me you have some kind of, if you have a visiting nurse, you got to talk to that visiting nurse about what you just said to me. Talk to them about hospice, see what they say. Okay, or palliative care. Yeah. Sorry, I'm like reading the chat. I'm so invested in Jackie now. Jackie, we have to help you. Hi, Julie. A hospice situation can definitely pull families together, but have you seen it tear families apart as well? Doug, I would say yes. I would say, oh my gosh, maybe not just as much, but almost just as much. Family dynamics play a huge role in hospice. And if you've had, even if your family is like a nice, loving family, right? But if you had decades of never talking about anything serious, right? Or if you lack vulnerability in your family dynamics, which many family members do, they lack vulnerability in the family. It's not safe to be vulnerable in your family unit, which is not even that uncommon. So it's not like you have to be in this crazy abusive home for that to be. It could be a very wonderful, loving home, but like, don't talk about anything bad, you know? That will continue even if someone is dying. So it can be difficult. So even if it feels loving, it still might not be like a talkative place where people are really opening up about what they're going through, how they're feeling. They have a difficult time for asking for help. All of that can play into it and can be really, really difficult. Different family members who live out of town, right? And then there's one sibling who does all the work. But then these siblings over here hear that mom and dad are sick or mom's sick, and then they get really scared. So then they start barking orders at this sibling. Then this sibling's yelling at them because like, you're not even here. Why are you telling me what to do? Why don't you be here? And then they say like, I would, but I can't. Like whatever it is, right? So, or these people over here will say, you're killing mom. You're putting her on hospice. How dare you? But they're not even around to see what's going on. So all those things can happen all the time. And you know who we call in those situations? The hospice social worker. The hospice social worker. If you see that happening in your family and you're on hospice, ask the hospice company to have a family meeting with the hospice social worker so you guys can all talk it out. Okay. Hello, Scorpion Heart says, hello, new here. Mom has a diagnosis with COPD, currently on 3 different antibiotics for bad infection, pneumonia. I was told she's going to have acute NSF. Can you please tell me if it's like hospice? I've never heard of this. Hold on. Acute NSF. I would ask them what that is. I have not heard of this. Are you in the US? So, Scorpion Heart, I'm so sorry. So NSF that I know of is like a certain type of fibrosis. It's not like a type of place. So hospice is, so I don't know how to answer your question. I'm so sorry. Maybe try to clarify it a little bit. She's going to need acute NSF. I don't know what that is. Do you know what NSF stands for? Like, if you do, tell me, because I do not. Oh, you're in Glendale too. Oh no, acute nursing facility is much different than hospice. Much different than hospice. It just means a skilled nursing facility, a place where she can have nursing care 24/7. Much different than hospice. Yes. Debbie and Amy, thank you for talking in the chat and stuff. You've been really helpful. I appreciate it. Thank you for everyone who joined the membership program. And for Bay Area Ghost, who just gifted a bunch of people that's seriously so amazing. Thank you so much. I'm glad you're here, Scorpion Heart. Welcome, everybody who just joined. I'm Hospice Nurse Julie. In case you don't know, I've been on here for about 45 minutes. I am live at 5 every Wednesday. We do have a great community here. So if you are lonely or you're a caregiver and you want support, you want friends, you need a community, this is the place. The membership program is just, it's $4.99, I think, a month. And it's just the group, and the group, like, I see who it is, so I can see your questions much easier. Once I get enough people in the program, I'm going to start doing lives just with them. It's just a little hard now because I don't have that many people in the membership. But right now, it just helps me see who's in the community so I can answer their questions a little easier. Thanks, Jordan. Welcome, everybody. Come on in. I'm just reading through the comments. If you do have a question, try to write it in all caps so I don't miss it. Thank you to everybody who's saying thank you to me. Thank you, Olivia. Thank you, T. Ann. Suzanne says, my father passed away on hospice from COPD. I prayed after he actually passed, but can you explain the almost black fluid that came out of his mouth when he died? It was shocking and scary. Yes, that can be very shocking and scary. I do have a video about this, not just black fluid, but black fluid, green fluid, yellow fluid, foamy fluid. Can happen. Most of the time it is from gastric acid, and it's because nothing is being digested. So all of our gastric juices will be in our stomach and not emptying. And then when we die, our sphincters, which you've got to picture like a balloon upside down. And like when you tie off the balloon, that little knot that's right there, like picture that being like a sphincter. And when we die, all of those relax. They kind of like whoop, open up. So they're like this, and they open, kind of like a butthole. But I hate to be gross or graphic, but that is what it's like. It's just like a butthole. So it kind of goes whoop, and then fluid can come up from there. So a lot of times people will die, and then everything relaxes, and then whoop, it comes up, and it freaks people out because that is awful and scary. And it's black sometimes because gastric fluid's usually like green. Sometimes it's yellow, sometimes it's black. So it can be kind of scary, but that's usually why. And that's also why people have, why they have bowel movements and urine, and they urinate after they die sometimes too, because everything just, so if it helps anybody, just picture your loved one's body. They are just first off, their consciousness is gone, but now it's just their body, their physical body, and it's fully relaxed, as relaxed as it possibly could be. So that's why you're having all these fluid releases. How do you let another family member know that you do not want to put your father in a nursing home, but they keep telling you you should? Depending on how close they are in my life, like let's say like an aunt who I barely knew was trying to give me advice, I'd probably let it go 1 or 2 times. And then if they really just kept pushing their will on me, I would say, because I've been working on boundaries my whole life, I would just say, thank you so much for your concern. That's not what I want to do, and I am not asking for your input. Thank you for caring, right? So thank you for caring. That's not what I want to do. I'm not asking for your input. It's a nice way of being like, fuck off. Now, if it's like your sister, right? Now you can still say that to your sister, but if it's like someone who also has a say in what happens, I guess, then you guys can try to talk about it. But in general, if like you're the decision maker and it's your thing, then you get to choose, and you can tell people that you didn't ask for their input. Thank you so much for caring. I'm so thankful you're concerned for me and for my loved one. As of now, this is what I want to do. I don't want to have them in the nursing home, and I don't want to hear your input anymore. Or thank you for telling me your input. I don't want to hear it anymore. You're allowed to set those boundaries. And guess what? People who don't like following boundaries and are offended by boundaries aren't going to like that. But too bad. Too bad. My mom is dying and is in pain. She's in hospice. I feel so helpless. She has a pressure sore on her bottom. How do I address it? Debbie, you need to talk to her hospice company. If she is having pain, you need to talk to the hospice company about them increasing pain medicine or giving it more frequently. Now, you will likely have to do that because you're probably the one caring for her. I don't know. Now, the pressure wound, sometimes it's no one's fault. Sometimes that just happens because the skin is an organ as well and the body is shutting down. So the main thing I want you to focus on is getting her out of pain. How do you do that? You talk to the hospice company and make them make moves on helping her not be in pain. Now, they will also tell you how to take care of that pressure wound, but sometimes, especially at the end of life, especially on hospice, our goal is not to heal the wound because that likely won't happen. The goal will be to keep it infection-free and to keep that person out of pain. So main focus, get her pain controlled. Talk to the hospice company. They need, and you know, a lot of the work is going to fall on you if you're the main caregiver, but you got to talk to the hospice company to make sure she's not in pain. And if that means giving morphine every couple hours, that means giving morphine every couple hours. That's what that means. So the main focus will be keep her out of pain, then help you address the pressure sore. Don't blame anybody for that because it's just the nature of the beast, because the skin's an organ that's shutting down as well. So there's poor nutrition, there's poor circulation. Pressure sores are sometimes going to happen. If it doesn't heal, it doesn't heal, but we don't want her to be in pain. I hope that helps. I hope that helps. Estimated time of death with non-alcoholic cirrhosis. Sharon, it's too hard to know without knowing more, to be honest. People can live a long time, and it depends on how advanced it is. It depends on if they're already on hospice or not. If they're already on hospice and it's already advanced, if they have a lot of ascites, are they eating? Are they drinking? How much are they sleeping? So there's so many things. If they're already on hospice, Shannon, ask the hospice provider. If they're not already on hospice, then they're definitely months out, which I know doesn't sound like a lot, but it's really hard to know. Thanks, AB. We got 6 more minutes, guys. 6 more minutes. I have to be right off at 6 because I have a meeting after this. 6 more minutes. Welcome, everybody. If you're new to this, I'm Hospice Nurse Julie. I'm a hospice nurse that educates about death and dying. I have my new book out for pre-order, Nothing to Fear, Demystifying Death to Live More Fully. You can get it at hospicenursejulie.com. Once you go there, it'll say like click to pre-order, and then you can see all the sellers for the book if you'd like to. Any question you can think about will be in this book. It's stories, but it's a lot of education, a lot of answering questions about what to expect and how to plan for end of life. The difference between a hospice nurse and an end-of-life doula is a hospice nurse is a nurse and an end-of-life doula is not. They are not like a certified nurse. Thanks, Jules. Jules just says, I am an end-of-life doula. So Jules knows, yeah. And actually, some doulas are nurses. There's like nurses who are doulas, and there's some people who are just doulas. Oh, Monique, I hope you're still here. Monique says, as a nurse, how do you keep patience with people? Some days better than others. Our nurses are so patient and kind. How do you do it? I do it by being a per diem nurse in a unionized hospital. So I'm a unionized nurse, which means I have rights and I can say no to assignments, and I can only have a certain number of patients each day. So I can actually take care of my patients well. I also work per diem. Even before social media, I worked per diem. So I always choose a large hospice company that needs a lot of extra help. And then I work per diem. And per diem means I only owe that company 4 days per month. Now, of course, I need to work way more than 4 days a month because I live in Los Angeles. Hello. But because I only owe them 4 days a month, I don't have to work on call shifts. I don't have to work holidays. I don't have to stay after for meetings, none of that stuff. So I usually work 3 to 5 days a week, but per diem. And then per diem, you get paid like usually $10 to $15 more an hour. So you get paid a lot more money, but you don't get paid time off. And I have to pay for my own insurance. So there's a trade-off. My whole point to saying all of this is because of that, I am way more full. I'm like, my cup is way more full. And then I can go to work and like be nice. Tibber, I'm glad you found us too. I'm probably saying your name wrong. Tibor. Tyler, I love that Tyler keeps using my stickers. Yeah, that's one thing. If you are in my membership group, you get little like emoticons of my face, which is hilarious. And you can put them in the chat. Thanks, Julie teacher. Good night, Mark. Thanks, Elizabeth. Thanks, Debbie. Yeah, so if anyone's in the chat and you see the blue stars, those are members. Auntie Lisa Bopipsa. Oh my God, I love you. Your name. So she says, what's the difference between palliative care and hospice care? Great question. I'd love to tell you. But it's actually it's not complicated, but it's like long-winded, and I have to get off the live pretty soon. So just go to my page, Hospice Nurse Julie, you're on my page. There's a video that's labeled Hospice versus Palliative Care, and it will tell you all the answers there, girl. Kathy here. Doc told my best friend with heart failure that once on hospice with Milrinone and meds stopped, survival is 2 to 3 days. What's your experience? Yeah, if a doctor is telling her that, that probably means her heart disease is pretty advanced, and the only reason why she's doing so well is because she's on X, Y, and Z medication. A lot of that could be, thanks, Elizabeth, a lot of that could be IV medication. Like this happens a lot. So someone's in an ICU. I used to work in the ICU. Their heart failure is significant, but they're alive and like doing well-ish because they're on a bunch of IV cardiac medications, keeping their heart pumping and working. Once you're on hospice, say someone's like, I'm not going to live in the hospital like this. I'm not going to live on these IV medications forever. I can't do that. And the doctor's saying you can't do it either. So they're saying, okay, so you have to go home on hospice. Once you leave this hospital, we have to turn off all these medications because you can't live with IV cardiac medications. So once you're home and off all those medications, your heart's not going to work like it was, and you'll likely die in 2 to 3 days, like this doctor said. So will that happen? Everyone is different. But when your heart disease is that, and again, I don't snap veganish. I don't know your exact situation. So I'm just sort of giving you like a general talk here. But yes, that could be accurate if someone is living right now in the ICU on a bunch of medications. So it just depends. I can't say for sure. I would say look into hospice, see what they say. But yes, if end stage heart disease, if that's what they mean, then that's what it means. And they will make her very comfortable and she may die quickly. Yes. I'm sorry if that's really hard to hear. Even hearing myself say it, I realize how hard that would be. Yeah. The Milrinone's IV infusion, right. She might be able to live at home on palliative care with Milrinone infusion. But if your friend is being like, I don't want any of this stuff anymore, I'm done, then that's what she should do. We need to go with what she wants. And if that's what she wants, I mean, I don't know what she wants, but if that's what she's saying, that's what she's saying. Okay. Shoot, it's 6:01, you guys. That means I have to go. Thank you for everyone who joined my membership. Thank you for Bay Area Ghost, who gave a bunch of memberships away. And thank you for everyone who is gifting me money. I see all that. Thank you. Thank you for that $20. Elizabeth Newberry. Let's see. Anything else? No. Okay. I kind of have to go, but yeah, I need to go to my meeting. I do. I need to go to my meeting. I'm the secretary of the meeting, by the way. That's so funny. Oh, wait, look at this. Oh, wait, hold on. Don't go yet. Let's see if you can see. Tell me if you can see what that is. It's a ladybug, if you can't tell. Could you guys see it or no? Probably can't. You probably can't. It's a painted ladybug on my nail. And if you guys don't know why I love ladybugs, go look at that video. It's a video. I know, I'm going to be late. The meeting's at 6:30, but okay, good. You did see the ladybug. Go, if you guys don't know my ladybug story, go watch that video. It's so amazing. Okay, I love you guys. You're the best. I'll see you next Wednesday, 5 p.m. Okay, bye.